entering people.
We are getting ready to go.
Charmaine,
Can you hear me?
just one second, please.
Uh-huh.
So good morning, everyone.
Good
Peace and
morning.
blessings, family.
Morning.
Good morning, everyone. Welcome.
Good morning.
All righty.
Good morning, everyone. Welcome.
Good morning.
Hi, Miss Galloway.
Good morning. Good morning, everyone.
Bright and early.
These are the people.
Good morning.
Good morning. Welcome. Thank you for coming.
Yes, ma'am. Thank you for being here and willing to share.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, together, releasing. We're teaching, we're moving. Together, together, we're learning, discerning. We're striving. Together, together, we're leading, connecting, transforming. Together, together.
Good morning, everyone. Thank you for joining today. And hello to the Facebook community as well. Just going to put my slides up.
All right, tell us who you are, beloved.
All right. I'm Dr. Kamila Barnes. I'm a family nurse practitioner. I am a professor, clinician, and also a community advocate. So I bring to you today stress, racism, and Black health. And what a very timely topic this is given our election today. And I understand that anxieties are running high, but we will be okay. So just go out and vote. Everybody get out and vote if you haven't already done so. Exercise your right. So we're going to get into presentation. As you're already aware, the presentation is talking about stress and racism on Black health. And we will also look at what are the different types of health disparities, what are the social determinants of health and how it plays a major role in health outcomes in our community. We will touch on different forms of racism and stress factors and how detrimental that impact is on our health in regards to morbidity and mortality of various conditions. So I just preface this presentation just to say that this is a very heavy topic, and this is really could be an all-day conference. but I'm just going to touch on the surface on health disparities. So if you have any questions, please put it in the chat or in the WhatsApp, and feel free to interrupt me as we go along. So when we look at health disparities and understanding what health disparities are, Healthy People 2020 is from the World Health Organization that examines health disparities on a global level. And health disparities are differences that we see between groups of people that are closely linked with social, economic, and environmental factors. So these differences could be, differences between a group of people of low socioeconomic status and high socioeconomic status, or between non-Hispanic whites and Blacks, or between religious groups, or those with disabilities, or those who are elderly population geographically. So comparing, saying with zip codes that we commonly see now with the tracking of COVID. And health equity speaks to not just equality. So equality is everybody gets the same, but equity is focused on attainment of the highest level of health for people. So in order to do that, number one, you must have support from all who have the power to deliver healthcare services and healthcare policies. Healthcare policies and governmental policies need to be fair and just. Our communities need to be funded adequately, provided the resources that they need. So one group of people may need more resources than another group. So that's equity. And in healthcare, providers like myself try to customize care to a specific person or a family, because it's not a one size fits all model. So precision medicine and customizing the needs to that person, that patient or that client, provide some patient-centered or family-centered care. But also understanding that health inequity is differences or disparities in health outcomes that is systemic, avoidable, and unjust. So many of the health issues that we see, the differences and the disparities are preventable. We can't blame people for preventable differences. So who are most affected by health disparities? Definitely at the top of the list is racial and ethnic populations. People who live in rural communities in comparison to those who live in urban communities or suburban areas. Women, children, and senior citizens. People with disabilities. Again, with low socioeconomic status, poor communities, underserved communities. Certain religious groups tend to have higher incidence of conditions as well. LGBTQ community, and also those who are experiencing mental illness, which we're seeing, especially with mental illness, we're seeing that play out with police brutality and shootings of unarmed Black men. So 2 questions: what are the factors that drive health and health equity? And how does housing play a role? And how do opportunities for stable and affordable housing vary in your state? So on this slide, we just focus on how housing is a major determinant of health. And there are many people who have experienced unstable housing or unsafe housing, for one, that definitely can contribute to poor health. Or dealing with issues like gentrification. So if you are working somewhere and you budget, your rent, your utilities, your medical bills, groceries, etc., and then your landlord just, the next year just shoots up your rent by $500, $600 a month, you're not getting paid more at your job. Your job does not, increase your salary based on what your landlord, how much your landlord increased the rent. So of course, we already know that increasing the rent is to push certain groups of people out, like Black people, Spanish people, disabled people, push them out of residences so that it benefits the landlord, so they can build luxury housing, or they can have certain groups of people in that building that they want and push everybody out that they don't want. So that's really another form of housing discrimination, but just understanding that housing is an issue for many people. We also saw this play out with COVID, and realizing that in the beginning, we receive a lot of messages about social distancing and 6 feet apart and hand washing, all these other messages, but understanding that social distancing in some areas is a privilege, because in certain communities, multifamily dwellings is common because the rent is so high, and to be able to own a home is even higher. So people live in clustered communities, and so there's no social distancing. And this is why one of the reasons why there were more COVID rates in certain communities, and still we're seeing these clusters throughout New York City. So in looking at childhood poverty, in 2017, more than 810,000 children live in poverty. So that left little left over for essentials like healthy food, transportation, medical expenses. So why is this significant? Because we know that poverty is a factor of health disparities. So some of the conditions, I'll give you an example, is type 2 diabetes. We're seeing more type 2 diabetes and cardiovascular disease in children. And what are some causes of that? There's a lot of different causes. One is sedentary lifestyle. Kids are more engaged in electronics, sitting around, no physical activity. Whereas in my time, my childhood experience, we didn't want to come in the house, right? So we wanted to stay out and play all day. Parents had to drag us from the street, okay? So now kids sit around, they're given iPads at like 2 or 3 years old. They're given Instagram pages as soon as they come out the womb. And also, food, highly processed food, and also the changes in health in general and the environment. So this is significant because, starting at 10-year-olds starting with type 2 diabetes, so diabetes that we would typically see in adults, now they're starting earlier in their lifespan with a very serious condition. So as we look at different health disparities, just to touch on a few that are like leading, we consider them leading health indicators. So health indicators are, conditions that we monitor and are able to see if it's increasing, decreasing, and also these are common chronic conditions. So in asthma, for example of health disparities, 2.6 million non-Hispanic Blacks reported they currently have asthma in 2015. And African Americans were almost 3 times more likely to die from asthma. And when it came to children have a death rate of 10 times that of non-Hispanic whites, and 4 times more likely to be admitted, so more hospital admissions. And you see this on, maps when we look at utilization of healthcare services. And then looking at diabetes, African American adults are 80% more likely diagnosed with diabetes, and more often type 2 diabetes, which is associated with obesity, which is associated with food and physical activity, et cetera, and the types of food that we typically have access to in our communities with processed foods and high sugar foods. Non-Hispanic Blacks, 4.2 times more likely to be diagnosed with end-stage renal disease. So typically this comes with diabetes, cardiovascular disease, stroke, so that's stroke, hypertension, heart attacks, renal disease, and also higher risk of lower limb amputations. African Americans also twice as likely as non-Hispanic whites to die from diabetes. So once Black people are diagnosed, twice as likely to die from diabetes, typically because of the comorbidities, meaning other conditions that accompany and complications that we experience. And looking at HIV/AIDS, African Americans represent 13% of the US population, but account for 44% of HIV infection cases. So our African American males experience 8.6 times the AIDS rate in comparison to white males. And for females, it's 18.6 times the AIDS rate. And looking at infant mortality, so touching on maternal child health, the United States has one of the highest infant mortality rates. So that's death before the child turns 1 year old in the world. And despite us being an industrialized nation, spending a large percentage of our global costs on healthcare expenses, we still have poor health as a nation overall. Looking at mass incarceration rates. So we know that this is an issue. United States leads the world in the amount of people who are in prison. And when you look at the breakdown of imprisonment in the Black community, you see 1 in 3 Black men are likely to be in prison in their lifetime in comparison to 1 in 17 white men and 1 in 6 Latino men. Then looking at Black women, 1 in 18 in comparison to 1 in 111 white women and 1 in 45 Latina women. So this is a major issue. We already know that there is more investment in prison systems and jails than there is in healthcare reform, than there is in educational reform. And this whole incarceration issue really destroys the Black family. So now you're down to, economically, in a financial sense, you're down to 1 set of income. And then also just the trauma of families that have to deal with incarceration and engaging in the justice system. We also know that many are locked up and are innocent. Everybody saw the Central Park 5 story. They spent years in prison and they were innocent. So it really absolutely destroys Black families on an emotional level, on all levels, financial, economically. And so we do need prison reform.
Dr. Kamila, just a second, 'cause I'm looking in the chat and seeing reactions from people. You said so much, and when I think about my own family dynamic and what some of the health issues are, and just dealing with incarceration, everything that you've touched upon, my family has been touched by. So diabetes, HIV/AIDS. My aunt, when I was a teenager, passed away as a result of her drug addiction. Well, she passed away as a result of complications associated with the disease. But what led to her contracting it was her involvement with substance issues, which has is a whole conversation, like why people end up in that space. And you're talking about toxic stress and other things. So we would love to be able to have the community just share how you've been touched by any of the pieces that Dr. Kamila has put out here today. So put in the chat how many of these pieces that she's presented you've been impacted by, whether it's family members or extended community or your chosen family, so we know what we're dealing with. And what was said in here is that these are very depressing statistics. My spin on that is our knowledge about what's going on will support us in being able to turn this thing around, because we can, because this is a wake up everybody community, wake up and transform our state of being regarding our bodies, and then also do something about how we engage oppression and racism in our communities. And one of them is what she said earlier, which is to vote. So Kamila, anything you want to say about that? Because this has stirred up a lot.
Yeah, it's very heavy, and it is very difficult to hear because, I think part of the emotion is also that we know that we are the oppressed group, right? And I think sometimes that can lead to learned helplessness, meaning like, oh, well, everybody in my family has diabetes, so I'm probably going to get it. And I'm just waiting for that, right? So we're just waiting for bad news, or we kind of expect it. So the standards are set low for our community. And then we also don't feel like sometimes we don't feel like we have that power. And if what Shani mentioned about voting, they looked at the last election and saw how many Black people did not vote, right? So it causes, it somehow conditions us to feel oppressed and also feel like these certain things are expected and that we don't have the power to turn things around. But I'm here to educate you about what's going on, but also to let you know that we all have the power to turn things around. And some of these issues are going to take generations to improve, just like our ancestors who fought for equal rights, fought for us to have equal treatment. And now we're reaping some of those changes. So it's not, some changes can be immediate and some changes are not. We have a question?
No, I don't see. You see a question?
I saw someone raise their hand.
Oh, they did. I missed that.
It went off the screen really quickly, so I didn't catch the name.
Okay, so let me ask, because I know Dr. Kamila only has X amount of time, so I'm going to ask that you use the chat for a sec, and then Kamila, towards the end, we can hear voices. So Teresa, thank you for raising your hand and being willing to share. So if everyone can continue to share in the chat, we can get more out of what she has to impart to us today, because she's not staying until 8:30.
Okay, thank you. I'll continue. So it's important for us to understand, how do we get here, right? Because the notion is that, and this was all on media, right? When Jared Kushner said, Black people have to want to be successful. In other words, pull yourself up by the bootstraps and figure it out. And so people quickly have amnesia about how did we get here. We did not just wake up with all of these problems that we see in our community. This was imposed upon us. And so this is just touching the surface of how did we get here. But housing discrimination, redlining. So all the years that it was fair, it was just to deny Black people, no matter what your status is, no matter what your career is, no matter how well your credit score was, to deny you to live in certain communities, to deny you loans for mortgage, loans for renovations. And that was legal up until the late 70s, right? Looking at reparations, Blacks and Hispanics and Native Americans have not received any reparations. Other groups have received reparations, and some of the descendants are benefiting from reparations. So you're starting the leg in the race, race of life, further along than in comparison to Blacks. Unequal treatment, that's everywhere. We receive unequal treatment historically in the educational system and the workforce, and the healthcare system. Still to this day, we deal with unequal treatment in healthcare. And employment discrimination. So people were really surprised that Justice RBG was not able to get a job despite graduating at the top of her law class, right? So if she couldn't get a job, imagine a Black person, or imagine an employer looking at the resume and seeing an ethnic name and putting that to the side, right? So we still deal with employment discrimination. Some areas have lack of access to food, to quality food. So it's mostly processed foods, government foods, fast foods, and lack of whole grain, healthy foods in the community. And that directly impacts our health. Medical Apartheid, that's an amazing book about the dark history of medical experimentation and in colonial times to present. And Dr. Washington wrote a phenomenal book. I implore you all to read that. And gentrification, which I already spoke about. And let's not forget the history of Jim Crow laws. And to be, in my opinion, is that today we still have a different form of Jim Crow laws. So what are the social determinants of health? So again, I touched on a lot of it, but just to quickly review, individual behavior is a small ounce of it, but there's also racism and discrimination, stress, educational disadvantages, healthcare access and quality issues, allocation of government funds. How are our communities funded or not funded at all? Educational system, how is our educational system funded? Which our educational system relies on property taxes, right? And also environment, toxins in the environment. I spoke about housing earlier. So some people are not living in healthy housing. There is asbestos in the walls, there's mold in the walls. And we talked about asthma. Asthma is environmental. That's how it's triggered. So environment plays a major role in health outcomes. And again, just touching on social determinants of health again, economics, so that's employment, income, expenses, people experiencing medical bills that can really put them in debt. Neighborhood and physical environment, housing, transportation, safety, parks. Can you go to a park, a clean park? Can you go to a safe park to get physical activity? Education, literacy levels, educational attainment, and vocational training. I was just speaking to an educator recently about vocational training should be in high schools and as provided as an option instead of just college, so that people can have skills to be a productive citizen and earn a living wage. Food access, I mentioned, community support and engagement, and also the healthcare system. And we do experience implicit bias and racism in the healthcare system as well. Socio-ecological model looks at the individual and all the factors that influence that individual. So that's individual attitudes, skill sets, knowledge. Then you have your interpersonal setting. So that's family, friends, social networks. Looking at organizations, so that's the community, that's looking at hospitals, institutions like academic institutions, and community relationships amongst organizations. At the highest level is public policy. So that's at your local, state, and national level. So when they talk about policy making, and so policy supersedes a lot of how healthcare services are delivered, how educational services are delivered, how environmental agencies are deliver their services. So we have to be a part of that dialogue when it comes to public policy. And I'm going to revisit this slide later on. So there's different forms of racism. One form of racism that I'm focusing on for this presentation is institutionalized racism. So what does that mean? It is explicitly racial discrimination by governments, corporations, religions, or educational institutions, or other large organizations. So basically organizations that have the power to influence lives of many individuals. And so these different sectors, if they create a policy that does not support Black communities, does not support educational systems, defunds, certain areas, certain sectors, that can trickle down to poor health outcomes. Or let's say money is defunded, or Medicaid is defunded, right? So that means less services are able to be rendered under Medicaid, or certain services are stopped, or if there's less grant money, right? then that may mean that a nonprofit may need to close down organization, or substance use program may need to close down, or they may need to lay off people because the grant money is not coming in. So these institutions really have a lot of power, but it doesn't mean that we cannot influence these institutions. And unconscious bias. So some of you may have heard of unconscious bias or implicit bias. These are learned stereotypes that are automatic, unintentional, deeply ingrained, universal, and able to influence behavior. So we are socially conditioned. The social construct of race, Black versus white, is a social conditioning. In some countries, they don't even know what you're talking about, right? They don't know what Black, white, they don't understand that. Right, they have other issues. It may be power or classism, but as far as color of skin is not an issue, right? So we are socially constructed. We are socially conditioned to develop bias, and so because there is bias, that plays out in how we interact with people, how we treat people. You know, the assumptions that are made. So, one of the things I mentioned was about mass incarceration and how there are people in prison right now who are innocent, but they are innocent. They're put in prison because of implicit bias. So speaking of healthcare issues, right? How healthcare providers interact with patients. Sometimes there's implicit bias in that. We just had a phenomenal Motherhood conference and we spoke about implicit bias and how Black women are ignored. So, you know, if you have the belief that Black people don't experience pain or don't experience pain in the same way, you can ignore certain symptoms that are red flags. And then that person ends up either very sick, that's morbidity, or passes away, mortality. So they have started implicit bias trainings in the healthcare workforce, but it needs to be everywhere. It needs to be in educational, it needs to be everywhere. And biases or racism, again, is a missed opportunity for early intervention to decrease morbidity. So if we are not aware of our biases, if we are not addressing racism, then we as a healthcare workforce are going to miss opportunities to intervene to decrease morbidity and mortality. So how does stress affect the body, right? So the first thing is that stress is perceived, right? So if I ask somebody, are you stressed out? They may be so used to stress that they don't even feel like they're stressed because that's just normal. That's when it's chronic. And then there may be people who always feel stressed out. They say, I'm always stressed out. I have so much on my plate. I have very little time for myself. I'm going to school. I'm working full time. I'm taking care of my family, and I have a sick family member. Everything is just piled on top of me. But for this presentation, we're talking about how racism causes stress and how the social determinants of health, how it impacts social determinants of health, which leads to stress that we experience. So short-term stress is that fight or flight. So in other words, you know, let's say you go hiking in the woods and you see a bear, right? When you see the bear, you go, oh my gosh, that's a bear. And you run away or you make noise or you just, you know, you don't even think about it. It's reactive. So your body goes into fight or flight because you're deciding to fight the bear off or you're going to run, flight. Okay. That is a natural autonomic response that your body makes. It's preparing you to fly, right? So you have a lot of changes that happen. You have your rising of blood sugar levels to give that more energy to those muscle groups so that you can get running, get going. You have higher blood pressure, you have faster breathing. You know, anybody who's experienced panic attacks, that is that faster breathing, you feel like you're having a heart attack. You have slower digestion and lower kidney function. You may see these in kids who have anxiety, they tense up, they can't go to the bathroom, their stomach always hurts, okay? Increase attention, your eyes, your pupils dilate because you're ready, right? You're ready to fight that bear. And faster metabolism. But the long-term response of stress is that if you're under chronic stress, chronic fight or flight, that you are experiencing that overload. And so it's wears down on your body, wears down. So this leads to health problems such as heart disease, high blood pressure, diabetes, diarrhea and constipation, sexual problems, gaining weight because that increased cortisol levels, okay? Then it shoots up your blood sugar, and then you develop insulin resistance, which is type 2 diabetes. So risks of high blood pressure can lead to heart attacks, can lead to stroke, having headaches, depression, forgetfulness, skin problems. So as you can see, it affects stress, long-term stress affects all parts of your body. So I just want to show a video about how institutionalized racism can link to poor health outcomes. And this video is from Unnatural Causes. It was a PBS series that was done, I want to say about 15 years ago. And they did a phenomenal job in displaying the health and racial inequities and also giving some historical context to, again, how did we get here? And so this video focuses on the Pima Indians, which is a tribe that still exists in Arizona, and some of the health outcomes they experienced when the government came in and changed their environment.
Well, there's a lot of debate and conversation currently looking at the role of genetics and environment in the problem that we see with diabetes in American Indian communities. So, for example, diabetes was exceedingly rare prior to damming the rivers in Arizona. There was actually a fairly complete health survey done right around the early 1900s. And what they found was one documented case of diabetes among Southwestern tribes. So it was not a common health problem historically when people lived in a different environment and had different lifestyles. Then what we saw was damming the rivers in the 1920s and 1930s. And then by the 1970s, some of the local tribes had the highest rate of diabetes in the world. So we did not see a tremendous genetic shift between 1900 and 1970. What we saw was a tremendous change in environment and lifestyle. So when we look at the allocation of resources, again, looking at this from a policy perspective, we will work with some communities and spend many, many millions of dollars on genetics research in those populations. And at the same time, we won't spend $40,000 for a PE teacher. So we haven't prioritized the allocation of resources to reflect the needs of the communities. We've allocated resources to reflect the needs of policymakers and the medical research community. And this really is a social injustice. But looking at it from a broader perspective, we're seeing an explosion of type 2 diabetes around the world. It's not just American Indians, it's not just in this country, but in the whole world, in developing populations. What we've seen is a tremendous change in diet and processed foods and things like corn syrup, which makes the availability of sugar that much greater in processed foods. And as a result, we're seeing a tremendous increase of diabetes throughout the world. And that certainly is not genetic. The world has plenty of healthy food. We just don't distribute it equally. And the people who do not have access to healthier choices are the people and the populations that are suffering the most from diabetes.
Okay, so I have some questions for everybody here today, and feel free to chime in. So what are your initial reaction? What are some issues that you identify as institutionalized racism? What are some of the social determinants of health that has contributed to this onset of type 2 diabetes that once didn't exist in this group? And what are some stress factors that can contribute to poor health? So feel free to answer any of these questions.
Alrighty. So Nija, I've seen some of your shares and Selena as well. And Teresa, I know you wanted to share earlier. So Nija, you want to start us off and share? And remember, this is not a test, so no stress.
Right.
Questions, and then maybe something else that you want to share. But we do want to unpack this so that we can get clear. So Nija, you ready?
Yeah, I mean, I don't know that I have anything new to share to the conversation, but it is just very stark and um it's when you hear the information and you know what goes on, it's just so disheartening that this is what's happening, that our communities, there's a lack of fresh food, fresh vegetables, but there are fast food restaurants on every corner, and there are just so many drugstores everywhere. And I remember in the 80s or the 90s, it might have been the 90s, where I recognized, at the time I was living in New York, I recognized that Dwayne Reed was popping up everywhere. And at the time I said to my mom, I was like, why is Dwayne Reed just showing up on every corner? It seemed as if they were building them at a rate of one a week. And I said to my mom, I was like, they expect everyone to be on some type of medication at some point. And now every time I go to the doctor, well, maybe not every time, that's an exaggeration, but a lot of times when I go to the doctor, they are quick to write you a script. And I always ask, is there something else that I can do before we get to the medication point? And they're just very quick to write you a script instead of talking about ways that you can alter your diet, increase your exercise, maybe make some slight changes to your lifestyle. That's not a conversation that they have or want to have unless you're going to a holistic doctor. And so to me, it just seems like it's not just one person or one institution. It's like a concerted effort to continue to destroy our health. And if we don't take control or just be more active in that, it 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 will continue and it will increase. So thank you for this. Like I said, I don't have anything new to add to the conversation, but I think that we should be continuing to have the conversation. So thank you.
Okay.
Thank you.
So Dr. Kamila, Jacqueline says the food is a huge problem. I know I live in a community where there are a lot of fruit stands. I live in what they call Little India in South Ozone Park. However, I'm so conscious that everything that glitters isn't gold. So even all the fruit stands, I'm conscious of there only being a certain level of fruit and vegetables. Nothing like the organic foods and stuff. They're just not on that strip. And while I can eat them and it's better than not engaging them, I'm just conscious that my choices are limited, even though they look like a lot. And then also what was said by Ketsia in Facebook is that it's poverty pimping. They spend money on problems, but not on solutions. You better tell it.
Absolutely.
Ketsia.
Absolutely. They profit off of, if you think about this Indian tribe that diabetes is running rampant, they profit off of them being sick, right? And they basically took their agriculture away. They took their way of living, and also in what's involved with agriculture is physical activity. So you took away their physical activity, and they did not provide them. So the whole purpose of damming the rivers again was to build these rich communities. Now, when we hear about Arizona, we hear about the social settings and why you should visit Arizona and the tourism. But those communities were developed and stripped the water supply from the Pima Indians, and they were left with nothing, literally. And they were given government food, which was low quality and high processed food, which contributed to type 2 diabetes. So absolutely, the profit is off of people being sick. And that's why we have so many health issues in America. So going back to the social ecological model, how can we combat institutionalized racism? So I already spoke about voting, but voting shouldn't just be every 4 years, right? Voting should be in your local and state elections, right? So voting for your councilman, knowing who your borough president is, knowing, keeping abreast of policies that are state, because there's some that vary from state to state and some that are federal. So having your knowledge about what's going on politically in your community and electing people who put the community as a priority. Getting involved with community work, so volunteering, being part of nonprofits, sitting on the board for organizations, being part of your child's PTA, so Parent Teachers Association, getting involved in the schools. Some of the things that because I've also worked in the school district is parental involvement. And I understand for some people, they can't get off of work, so, but putting pressure on, now we're in a virtual world. So now we're accommodated to whatever space you're in. I don't care if you're in the car, I don't care if you're at work, you can just Zoom in, right? But putting pressure to state for the school to make sure they communicate and that it's a partnership with you in the school. And then other organizations to you can get involved with, to volunteer and also be at the table where there's heavy decisions that are being made, be part of the town halls that your councilman has, being part of that conversation, knowing what's going on in the community. And with that, you can also influence policies. You don't have to be a politician. You don't have to be, be the VP of a bank or be the VP or the chancellor in the educational system in order to have a say in policy. Anybody can introduce an issue. You can even set up a meeting with a group of your friends, with a local politician, and talk about issues that are affecting your area. This is how policies are created. And so everybody here has the platform to influence policy. Advocating for change in your communities. So reporting things, using that 311 to file complaints when you see things. I reported sanitation issues in the park. I said, I'm tired of going to the park to exercise and seeing trash all over the place. So taking pride in your community and not just accepting that this is what it is or it's not my problem, right? I report things like accidents. If I see increased accidents or things like that, that's what 311 is there for. You file the complaint, they give you a complaint number, and they'll give you the status, and they are supposed to act on it. So we need to be more vocal in things that we see that are unjust in our communities. And engaging in educational events like this. So again, it's a heavy topic, but it's good to share knowledge, right? Because that's how we are aware. And that's why it's wake up everybody. We want Black people to stay woke. We don't want Black people to just rah, protest when things go wrong and then go to sleep. And that's some of the waves that we've experienced historically, because we get back to our busy lives, and then the problem is forgotten and we don't follow through and make sure that this doesn't, the issues that we're seeing are resolved, or the issues that we're seeing are not happening over and over again. So we want people to stay engaged and stay involved, so that and to see through it that change is being made. And then lastly, how can we minimize stress? So what do we also have control over? So engaging in healthy eating. So we spoke about food deserts in certain communities or food options. Now, some areas throughout the United States, communities have taken it control over food options and have, food markets. I know when I lived in upstate New York, I can go to the farmer's market. That was amazing. There were so many vendors there. I can get all my fresh fruit and vegetables, no processed foods, fresh meats. So I know also that some places they're starting gardens. I know that some politicians one politician that is running for mayor currently, New York City mayor, spoke a lot about reforming the food options that are available to kids in the school system. Because even though many kids receive free or reduced lunch, they don't receive healthy foods. The options on the lunch menu are not healthy. And the school district provides 2 meals a day to students. So getting involved in agriculture in your community and where the food sources come from. Physical activity, exercise, getting adequate sleep. So that can involve restructuring, being more organized with your schedule for the week, meal planning for the week, whatever you need to do to incorporate healthy lifestyle, finding time to meditate, spending time with family, setting boundaries with work, not working all day, all night for weeks and months at a time and not taking breaks or taking vacations. That is going to lead to chronic stress. And some people do experience weight gain with chronic stress. Also, in regards to mental health counseling, if you need mental health counseling, seek it out. That could be issues with your spouse. That could be family issues or family dysfunction. That could be personal things that you're dealing with. There is stigma attached to mental health counseling because, for some people, the thought is that they're just going to throw me on medications. But you have the right to refuse medication. And therapy is essential sometimes. We all need a therapist, okay? There's a lot that goes on in our lives. Sometimes curveballs come or you have that bad year. We all can engage in mental health counseling. And engaging in a hobby. So finding something that you're passionate about, whether it's painting, whether it's dancing to music, whether it's knitting or sewing, maybe joining playing cards with friends, whatever a hobby that you have that you're passionate about, riding bikes, whatever it is, engaging something to take your mind off of what's going on. And that's all I have for today. And I'll open up to any questions. So I'm going to stop sharing my screen.
Okay. So Teresa, there was a comment or question that you had from earlier. I want to make sure that we come back to you. So if you could unmute, and wherever possible, folks can come on camera. That's great. No pressure. It's just great to be seen.
Hi, good morning. I
Yeah.
just wanted to say that in going to the doctor for myself lately, I'm very aggravated because they just want me to be like instead of finding out why I'm having a problem, they just want me to take a pill. And so I tell them I'm not taking those damn pills, and don't tell me to take no pills. And when I read up on the pills, they be like, well, one doctor told me the other day, it was like, oh, it's just a million. I said, I don't care, ma'am. I said, for some reason, my body seems to be giving me a problem more with all these pills than what they are. And why not find out what's going on before you just give me a pill? And so that's one of the issues. And then like recently, even my own insurance company told me I had to be put on a cholesterol pill because, I was dealing with diabetes and high blood pressure, but my diabetes and my blood pressure is really under control. So why add another pill, like a cholesterol pill, when my cholesterol level is great? So, that's kind of confusing because, and then they tell you also about your family. Well, if your mother got it, you got it. So it's like the mindset of, I'm just going to be sick all the time is what the people are telling me. And it's very, discouraging, but because I educate myself and because I read and I take different herbs and different things, I'm doing better. But what about the person who does not know how to do that or believe in a doctor so much, everything they tell them, how do they handle that? That's what my issue is. Thank you so much. I appreciate everything you said. It was great, ma'am. Thank you.
Thank you, Teresa. And just to respond to that, there's a notion that, there are medications that people have to be on to survive. So somebody has type 1 diabetes, they require insulin and they need that for survival. But many of the health conditions that we experience, like that are quote unquote modifiable or preventable to begin with, there's a notion of you're on medication and this is for the rest of your life. And we're just going to keep adding medication because you're going to come in, then you're going to say, I'm starting to have this side effect. Then they give you another medication for that. Then, oh, I'm starting to have another side effect. Then they add, the next thing you know, you're on 5 to 10 different medications. There are living testimonies of people who have transformed their lives, maybe gone on plant-based diets, maybe started losing weight, may quit that job that was causing them so much stress, right? And move on to another career. Whatever the case may be, and have gotten off of most medications, or if not all medications, even those with diabetes have gotten off of insulin. So it's a conditioning of a mindset of you're going to be on all these medications and we're going to keep profiting off of sick people.
All right. Other comments, like the chat is booming, Kamila. A lot to say. And I'm not me as a personal testimony, but I have several friends and colleagues who have reverted their diabetes to like they were diagnosed and then they changed it around because of diet and exercise. So it is possible for sure. Let me see who else is up in here. Selena, you've been saying a lot in this chat. So can you unmute and share? Selena is your guest, Kamila? Is that
Thank you so much. I'm sorry, I can't turn my camera on. I set my alarm, so I'm still in bed. But a lot of these things certainly resonate with me. And as a healthcare provider, I think it's really important for us to do the work in our communities. We certainly have to educate our communities. Historically, you know, our people have been given the scraps, right? We were given chitlins, we were given pig feet, and those are some of the things that we still eat. It's a part of our culture. And we weren't really thinking about or prioritizing eating healthy foods. We ate whatever we had, whatever our parents could provide for us. We didn't grow up prioritizing exercise because our focus was on survival. So there are so many historical factors that Dr. Barnes has mentioned, but you know, these statistics are alarming. And if we had better access to healthcare, if we had safer areas to exercise, if we had better access to food, healthier foods in our neighborhoods, these things could be reversed. Unfortunately, that's not what's happening in our communities. So, you know, this battle is not just ours. We need others to help us to dismantle these healthcare disparities and the structural racism, institutional racism, because, you know, it's created a public health crisis for us. So I think we certainly have so much more work to do. I think that forums like this it's definitely helpful in educating us. We have to go a step further, but we certainly have some of the tools that we need, some of the knowledge that we need to sort of tackle a lot of these things. So thank you, Dr. Barnes, for your very informational presentation. I think we need a lot more forums like this just so that people can be aware. Like Teresa said, she's educating herself. And so we need more of that in our community and need to stress the importance of our community members learning about their healthcare diseases and, you know, advocating for themselves and really getting involved in their own healthcare. So again, thank you so much, Dr. Barnes.
Ashay?
Thank you. Thank you.
Doc, I know you have to transition from here soon,
We'll
but
take one more question.
also or comment because we'll see.
Comment, yes. Yes.
Felicia, I don't know if it's Felicia or Felicia Harlow. I would love for you to talk about meditation and us to end on a note that is about opportunities for us to heal and transform, and holistic opportunities, because there's lots that we can do to transform our health statuses. So Felicia, are you willing to unmute and share?
Absolutely. Can you hear me?
Yes, and we can see your beautiful face, so thank you.
Thank you. Thank you so much. I had obviously, as everyone else here, had experienced a lot of stress in my life, and I brought meditation into my life, and specifically heart rhythm meditation. And it has been a complete turnaround for me and my entire family. And it essentially is aligning your breathing patterns with your heartbeat and using different breathing patterns in order to increase your level of optimism, to bring your levels of stress down into a calm. Anything that you desire, you can use with the combination of breathing and linking your heartbeat up to that. And it's just been an incredible shift and change and positive results in my life and my family and the people that I coach.
Awesome.
So thank you.
Thank you. And it also helps people deal with anxiety, you know, which can cause all these symptoms that we run to the doctor for, and sometimes they don't find anything wrong with you, but it's the underlying anxiety and stress. And so when you don't have those tools like meditation, you don't know how to deal with it, and it can lead to other health problems. So thank you.
Yeah. So Doc, it's 8 o'clock. Final statement, words that you would like to leave the community with?
I just want to thank you all for being engaging and listening. And I hope you share this information with others. And you have my contact information. If you want more information about things that I spoke about, I'm willing to speak with you on a personal level. You know, this is just so important for all of us to be engaged with transformation. And despite all of the heavy statistics that I shared, I still try to be optimistic. Despite of whoever's going to be president after today, I try to still be optimistic and say, okay, let's work in with the cards that we are dealt with, and we can change those cards and make it a better living standard of living for ourselves, but also for generations to come. And that's what I believe in.
Beautiful. Thank you. So, John, if you could put the slides up so that we can do what we know how to do in the wake up space and be complete.
The first slide I'm showing here is Dr. Barnes' website and special offer where they can contact you.
So anything you want to say about this?
Would you like to speak on that?
To contact me?
Yeah, your special offer. I know we mentioned it this morning.
Oh, so my website is B as in boy, HAPRO.com, BHAPRO.com. So you can visit the website and look at programs and services and contact me if you want any of the services. I also have continuing education on the CE tab. Now, continuing education traditionally is for, you know, healthcare providers, but you don't have to be a healthcare provider to listen to the content. You can sign up. There's like a tab in the middle of the page, Dropbox, and you can purchase any of the continuing education courses. So anybody, any healthcare provider, or anybody outside of healthcare can listen into those live, those webinars.
Beautiful. And so here's your contact information, as was mentioned earlier. And I love that you said that. It's like if folks want to unpack some stuff or ask questions or connect with you or book you to present, because that's an option too. Here is Dr. Kamila's contact information so that you can be in touch and continue to grow and expand and inform yourself and also inform her, because it's reciprocal.
Absolutely. I learn from others all the time.
All right, and love offering. So if you're new to this community or even this terminology, in the wake up space, we engage in the sharing and receiving of love in different forms. Part of that love offering today was Dr. Kamila sharing and imparting knowledge based on her studies and her personal experience and just her brilliance and what she's been gifted to do and be in the world. And we also exchange love in the form of dollars and cents. Money is energy. And in the wake up space, we talk about money as my own natural energy yield. So it's an acronym, my own natural energy yield. So we ask that you share that energy with Dr. Kamila so that she can continue her work and so that you can honor her and declare that what she has imparted has been a gift that deserves the experience of reciprocity as a spiritual principle. So we are grateful for sure, and we ask that you take a moment and to donate, and you can utilize Zelle QuickPay through soulleadership@gmail.com. Oh, I think the other. Let me put the other. I just muted you. All right, and then Cash App is $ Spirit of a Woman, $ Spirit of a Woman, $ Spirit of a Woman. And the code that you would use is hashtag 188KB. And so we're about the business of being activated and taking action so that we can share, grow, and awaken ourselves. Like Kamila said, stay woke. And like the opening song says, stay woke. And how we do that is by sharing and showing up. So we can move forward with the next slide. So tomorrow, one of Camila's good friends and somebody who is my heart is Sister Chantel Gamble. She has blessed us on many occasions in the wake up space over these last 188 days. And one of her last talks was about living single and just exploring the grieving process when you lose relationships. And she was speaking specifically about a relationship ending at the top of the quarantine, and just what was availed to her, and how she processed that grief and that loss and negotiated being on her own, literally and figuratively. So tomorrow she will unpack the conversation for 30 minutes. It's our shortened wake up day, but it's still packed full of punch. So please do join us for that conversation. Then the next day, Thursday, which is the final day for our wake up weeks, we're going to have Reverend Niamo Nancy come back into the space. Now, I love her energy and her spirit. And she's going to talk about the International Black Summit and how its conversation of possibility can change your life and your energy. So looking forward to being with her. She is just so dope. So that's Thursday, November 5th. Please invite people. You know, when you think about how we get to be with one another, like set a date for you to hang out with someone. It's like, oh, meet me over breakfast. So I'm going to be over here in the Zoom space eating my breakfast, and my friend is going to be eating her breakfast or his breakfast, and we're going to be listening to Wake Up, and then we'll talk about it afterwards. Set a date, be innovative, be creative, but be engaged in inviting others to share in this space with you. So let's go to the next space. All right, here's the schedule. So Sunday, Tuesday, Thursday, we have the extended day, and today is Tuesday, so we have the experience of the 90-minute format. And then Monday and Wednesday, we have the 30-minute format, all great, no missings at all. And then on Friday and Saturday, we are off. And I say we're off to apply the things that we learned from from Sunday to Thursday. So there are no off days in waking up. We're always working on our awakenings. Oh, tongue twister. All right, next slide. Here we are to say thank you and acknowledge you for your presence and participation in the co-creation. So please do register if you haven't done so already, so we can capture who declared that they would be in the space this week. If you're new to the space, please join us on the Facebook page by using the bit.ly registration or typing in Wake Up Everybody Virtual Community on your Facebook account, and you'll find us and you can join or ask to join the page. Instagram is at Wake Up Series. We're on YouTube. Woo on YouTube, and then you can email us at info.wakeupseries@gmail.com. Now we're going to go into gallery view so we can see all of the awesome wonders in this space. Thank you, John, for taking down the slides so we can see all of these names and some faces. Please come on camera and unmute yourself so that you can thank Dr. Kamila for what she has offered to us today, because in the Wake Up space, we show our gratitude through love, through our voices, through our expressions and our affirmations. So please come on so we can provide that and she can hear that and feel that.
Thank you.
Thank you so much.
Thank you so
Thank
great.
you
Thank you, Dr.
very much.
Barnes.
So happy to see you here. So
Thank you
thank you,
so
thank you,
much.
thank you.
Have a beautiful
So
day,
happy
you
I'm
all.
home
Yes,
today.
thank you,
Truly
honey. Thank you very
appreciate
much. That was
this.
very
Much
enlightening.
love.
Glad to
A
see
lot of
everyone.
wonderful
Thank you.
Very,
Have a
very
information,
great day.
enlightening.
Informed decisions,
much to think about and act on,
Great information.
not just talk about it, but thank you for this. Thank you. Thank you so much.
Thank you so much.
Truly appreciate you.
Very informative.
Great
Your
information,
time,
Dr. Barnes, along with
your
some
knowledge,
solutions.
Very
Appreciate it.
pouring into us.
Thank you.
Thank you.
Thank you.
Love you.
I'm sure
Thank you so much.